Hi, everyone. I want to say thank you for taking the time to join us. Home care malpractice and documentation, the QA education session. This is a follow up from the CHF that we are learning this past month of March. So, we're going to be focusing on the documentation, EVV, and the legal protection. So, this is just not about the compliance, this is about protecting your license and everything that you do and how it comes back to you. So the one question you can ask, can your documentation defend your care? This is not just about, like I said, the compliance, it's about what's happening in the chart. So at the end of this week, end of this lesson, I want you to take time and think differently when you're documenting your visits. So here is the case overview. Let's start with this real scenario in home care. So a patient was admitted for CHF management. The nurse documented a full assessment, including assessment of all head to toe, education, and medication review. But when the chart was audited, the EVV showed a 12-minute visit. The, the story was too short. So after this whole thing happened, the patient was hospitalized. And the family stated that the nurse was only there very briefly. So now we have a problem because the documentation and the visit time does not match. This is where the legal risk happens. So that is why when you clock in, clock out using EVV, it needs to match what is in your documentation time. So the 12-minute visit, is that real or not real? So what went wrong? When your visit time does not match your documentation, it creates doubt. The visit time does not match anything like your head to toe assessment, medications when you reconcile them, education cannot realistically be done in a short visit. So yes, you're able to have 8-minute visits, but you can't do all the things that need to be done in that time. So what happens? The entry note becomes questionable. And once your credibility is questioned, everything in the chart is questioned and everything you do is questioned. So the legal risk, if this case goes to court, the argument is simple. The nurse documented care that likely was not completed. That leads to concerns about negligence, incomplete care documentation accuracy, like is it accurate? This is how cases shift towards nursing and the agency. It's not because the care didn't happen, but because the documentation didn't support it. So I want to be very clear here. EVV is not just for payroll. EVV is a legal proof that you were there in the home and you did your job. It shows when you arrived, it shows when you left. Your EVV is short visit, but your documentation shows a full visit, full head to toe. These are two conflicting things. So in a legal review, the conflict weakens your documentation because you can say that you did all this stuff, but your documentation has to prove it, especially if you have short EVV times. So documentation rules. There's a simple thing to follow. Number 1, document what you actually did. Number 2, keep it realistic. Number 3, avoid copying and pasting notes. Your documentation should reflect your actual visit, not what you should have done, not what was done last visit. What did you do today? So where we have the CHF focus, these patients are high risk and documentation matters more. You should always include the weights, the trends in edema, lung sounds. Are they short of breath? Do they have endurance? So most important thing, did you act on what you found? Did you notify the MD of something changed? Because documentation at a problem, like without action, creates the risk. So where we have OASIS alignment, OASIS must match your assessment. You cannot guess an answer. You cannot copy from a previous visit. The OASIS reflects your clinical judgment as a nurse. You went to nursing school. The NCLEX and all that is clinical judgment. So if your OASIS does not match your documentation, it creates a clear competence issue and affects reimbursement for what we get as an agency and what you get paid as a clinician. So here's the checklist. So before you submit your note, I want you to pause. Does my visit time match my documentation? Did I include clear, specific findings? Did I notify the MD needed? And this goes under the care coordination section. And most important, would another nurse understand exactly what happened during this visit by reading my note? It paints a picture of what happened while you're there. So when you have these vague notes, they're long, they're beautiful, but it's like I can't follow along with what's happening with this patient, especially this important CHF patient. So the final takeaway, as I said, is EVV proves you were there. Both must align. That is how you protect your license. You worked hard for your license and we want you to protect it. And we want to protect the agency. So we're not here to criticize your documentation. I'm here to kind of protect you. Because if something goes wrong, your chart is the only thing that speaks for you. I want to say thank you for taking the time. And if you have any questions, reach out.